Foreign body ingestion is often called to the attention of poison control centers. The most common of those is desiccants, which are those little silica packets that keep pills dry inside a bottle of pills. And they'll say right on them, do not swallow. So that often generates a call when they are swallowed to a poison control center. Those kids are generally at very low risk of any complications if they develop symptoms like vomiting, sore throat, pain, refusal to eat or drink, then those kids should be evaluated through a chest x-ray or maybe by a gastroenterology type specialist, but almost always they do well. So it's more of a scare than an actual complication that's going to cause problems. There's a myth out there that most glass doesn't show up on an x-ray. Only leaded glass does because it has metal in it. And in fact, that's not true. Almost all glass does show up on an x-ray. So when children swallow glass, getting an x-ray almost always will find it. Now, if you do find glass, what you need to do about it depends on where it is. If it's in the esophagus or in the stomach, you might, if it's a sharp piece, want to refer the child for a removal procedure like endoscopically. If it's in the lower GI tract, you can almost always follow it and it will pass spontaneously on its own, with a little anxiety along the way as people get nervous about it, but it almost always goes real well. Well, people got very concerned when penny production went from being almost all copper pennies to pennies that are almost all zinc with a thin copper coating, because zinc in the presence of the stomach acid can really lead to a heat and a reaction, a chemical reaction, and that can lead to problems in the stomach. And initially there were a couple described in children who had swallowed zinc pennies, but fortunately now we have a more than 10-year history, and that's really a rare complication to have the stomach ulceration. So it was originally described and it can happen, but it's really rare. So I think that watchful waiting is still an appropriate strategy for a child who swallowed a penny. But you do want to know that if the child develops a stomach ache or vomiting blood, that you need to act on it because that could be the reason. Button battery ingestions and their outcomes have been really well studied. One of the best kind of classes of foreign bodies that have been studied. And they are known to cause real problems if they sit in one place, especially the esophagus after they've been swallowed. They can really lead to potential serious complications. Once they've reached the stomach or the lower GI tract, they almost always pass right along. But if they don't, you want to know about that. So there are recommendations that people sometimes get serial x-rays every few days. Exactly how many days, really not well known. I might say every week, but with the caveat that the child's parents should bring him to attention sooner if he develops any kind of complications or symptoms, vomiting, blood per rectum, stomach ache, that kind of thing. They should come right for attention. Otherwise, probably every week is a good approach. But there really aren't data to guide us exactly on how frequently we should get serial x-rays.